It is going to be hot and humid, a little bitty respite for Mother's Day, not as hot, but we're getting that time of year where it's just going to be muggy and miserable. May is National Osteoporosis Awareness and Prevention Month. Osteoporosis affects more than 50 million Americans, causes nearly 2 million broken bones each year. Dr. Brent Wallis, our friend, Dr. B, Chief Medical Officer of People's Health, joins us to discuss the condition and share some tips, rather, for keeping our bones strong. How you doing, Dr. B?
Hey, Tommy, I'm doing okay. How about you?
You remember when the Stones played Jazz Fest?
Just barely.
Yeah. Tell me, what is osteoporosis?
So osteoporosis is really just a disease of weak bones, and a lot of people don't realize that bones are actually living tissue. So they're constantly being broken down and then replaced by new bone tissue. And that process actually keeps your bones strong and prevents them from breaking in a lot of cases. But as you get older, that process slows. So osteoporosis really happens when the body can't make enough new bone to replace the old bone that's naturally just dissolving and going away. And so bones that are affected by osteoporosis really become very weak and brittle. They can actually develop holes within the bones that makes them, more prone to fracture. So even a minor fall or even maybe a twist or stress on a bone can actually cause them to break.
I know you didn't mean to do it, but you just made me feel really dumb because I guess I always thought that your bones were just bones and they didn't change and those were the bones you had, but that's not true at all.
No. They're a living organ, just like other things in your body, and they're constantly changing.
Who is most affected by osteoporosis?
Yeah, so really the most common time we see osteoporosis is in people after they reach age 50. And then what happens is that increased risk for osteoporosis continues to go up with age. And it's also really more common in women than it is in men. And the reason for that is because men generally have a higher bone density than women and actually slower bone loss.
All right, who's that? That's my buddy, the boxer. Who is that? Which one's that?
Yeah, that one's Jackie. He's a little upset this morning. Giacomo.
Good to hear from. It's good to hear from him. It really is. But anyway, family history is important too, right?
Yeah, exactly. Family history there's a very strong connection. So if you've got a close relative, somebody like a parent or a sibling, you're much more likely to develop osteoporosis as well.
What else rather increases the risk of osteoporosis?
Well, really, if you're underweight or naturally thin, you're going to have a higher risk because you're not putting as much pressure on those bones to keep them strong and healthy. And then a huge risk factor is actually smoking cigarettes or drinking a lot of alcohol can really increase your risk as well. And then the other thing we look at is certain chronic conditions, certain types of cancer, and then kidney disease in particular.
Does osteoporosis have any symptoms per se?
Yeah, I mean, that's the problem. Most often, osteoporosis does not have any symptoms at all, and that's why we call it one of those silent diseases, because a lot of times people don't even know they have osteoporosis until they have a fracture. So they may actually slip and fall, maybe try to break their fall with their arm, and they'll break their wrist. We see a lot of hip fractures and then sometimes even spine fractures as well. So there are occasional symptoms with people. If they have really severe osteoporosis, they can develop some back pain, even some shortness of breath, which is usually related to that hunched posture that you may see. As people get osteoporosis, they tend to bend forward, and it makes it a little more difficult to breathe. And that also causes a loss of height. So if you've got any of those symptoms or one of your loved ones does, then you want to talk to your doctor about that.
I don't need any loss of height, believe me. Without symptoms, how do you know if you have osteoporosis?
Well, yeah, you don't want to wait until you have an accident and break a bone to find out you have it. So fortunately, there's a really easy screening test that can be done to check for osteoporosis. And it's called a bone density test. And what it does is it measures how strong your bones are. It can tell you if you have osteoporosis or if maybe you're more prone or kind of leading up to osteoporosis, and then understand what your risk of having a bone breakage in the future is as well.
Who should have that screening?
So the screening is universally recommended for women that are age 65 and older, but it may need to start earlier if you've got some of those risk factors we were talking about, especially very underweight people, especially if you've had a fracture in the past. Your doctor may recommend that you get screened a little bit earlier, but your physician's going to be able to tell you what the screening schedule is and whether or not it's right for you.
It seems almost counterintuitive. You would think the lighter you are, the easier it would be on your bones, but not the case.
Yeah, no, not at all. And part of the reason for that, again, is the pressure down on your bones forces them to replace themselves more often, so it actually builds stronger bones.
How about men? Should we be screened for osteoporosis?
It depends with men. The guidelines currently don't recommend regular bone density testing for men, but you really do need to be screened if you're a man for anything that may be high risk for osteoporosis. In particular, like I mentioned, certain types of cancer that men can develop, and then also kidney disease. So, again, you want to talk to your doctor if you're a man to see if maybe a bone density test would be good for you as well.
Do men get that kind of humped back or hunched over look like women get the same thing? It presents the same way?
Yeah, they definitely can, and they tend to be a little bit older, and it definitely is less frequent than what we see in women.
All right, let's take a break, and then we'll come back. We'll talk about how you can lower your risk for osteoporosis, what's a good workout goal, and it all comes back to diet, I guess. Are there foods that lower your osteoporosis risk? And vitamin D, I know, is very important. And, Doc, it always comes down to smoking. If you don't smoke, don't start, and if you do, quit.
Absolutely, every time.
Thank you, sir. Dr. B is our guest, Dr. Brent Wallis, Chief Medical Officer of People's Health. It's May, National Osteoporosis Month, and we're talking about ways to treat it and ways to prevent it, screening and more. When we come back, we'll pick it up with ways to lower your risk. Right now, 820 Traffic WWL. All right, 825, Tommy Tucker, WWL, talking to our friend Dr. Brent Wallis, Dr. B, Chief Medical Officer of People's Health. May is Osteoporosis Month, and we're talking about ways to, what the symptoms are, how to know if you have it, and who should be screened. Men and women can both get it, women more so than men. And, Doc, how can you lower your risk of getting osteoporosis?
Yeah, so there's no clear way to prevent osteoporosis, but much like a lot of other chronic medical problems, healthy habits can really lower your risk of both getting the disease but also getting a fracture related to osteoporosis. And so, like we were mentioning, impact to the bones, minimal impact to the bones is actually healthy for people with osteoporosis or to prevent it from developing. So regular exercise is critical. It can strengthen the bones. It's going to slow that bone tissue loss. And then it actually also helps you to build other muscles that can help your balance and prevent a fall, because you're more likely to have a fracture if you fall with osteoporosis. So what you want to do is you want to look for weight-bearing activities, things like walking and dancing. Those are exercises that keep you on your feet with your bones supporting your weight, so it's going to help to make your bones more healthy. And then, like I mentioned, balance is really critical, so you may want to do yoga or Tai Chi to make sure that you're able to support yourself and kind of build your core.
And, of course, you always want to check with your doctor first before you start any workout program?
Yeah, absolutely. You know, you have to be careful with any type of workout that you're doing. We recommend about 150 minutes of exercise each week as a minimum. So most people break that up as 30 minutes a day, 5 days a week. It's pretty easy to work into your normal routine, but you have to be careful when you're starting an exercise program. And it's even more critical for people either at risk for osteoporosis or with osteoporosis, again, because of that risk of fracture. So you want to work with your doctor to create a really safe and effective exercise plan that'll support you and your activity level.
How about some foods that can lower your risk for osteoporosis?
Yeah, nutrition we talk about all the time, and it really is critical with this disease as well. In particular, most people know calcium and vitamin D are the two most important things to building strong, healthy bones. So what your mom told you is absolutely correct. And really one, great source of calcium is dairy products. So things like low-fat milk and yogurt and cheeses are very good. But if you can't tolerate dairy products, like a lot of people can't as they get older, you can get calcium from other foods. So things like dark green leafy vegetables, things like kale and spinach and collards are really rich in calcium. And then almonds in particular are a great source of calcium. And then for those who like fish, fatty fishes, things like tuna and salmon can be a really good source as well.
And what about good sources of vitamin D?
Yeah, so there are a lot of foods that contain natural vitamin D. Those fatty fishes, again, actually are a great source. And then mushrooms in particular are a good source. Yeah. So that's a great source. And actually it's absorbed really well when you get the vitamin D through foods. And then the other thing is a lot of foods are actually fortified with vitamin D. And that's something that the FDA does to actually increase those levels and reduce these risks for people. So you may see it on labels. In particular, the one most people may be familiar with is orange juice. It'll say fortified with vitamin D, and that means that they've actually added some vitamin D to the product. And then the other big source of vitamin D is actually sun exposure. And the thing that's interesting in Louisiana, though, you think we've got all this sun, it's sunny a lot of the time, but what happens as we get older is we tend to go out in the sun less. And so you can actually get a vitamin D deficiency simply because you're not actually getting exposed. The one thing to keep in mind, though, sunburn is very bad, and so be careful. Make sure you protect yourself with sunscreen if you are trying to get your vitamin D through the sun.
What about supplements?
Yeah, you should talk to your doctor about supplements because they definitely can help, and often we will have people take supplements of either calcium or a lot of times calcium combined with vitamin D. That can actually help boost your nutrient levels. The one thing is, though, the supplements are not as well absorbed as the regular foods, and so I encourage people to go for those green leafy vegetables and the fatty fishes because that'll be absorbed better.
Some final words, Doc, about osteoporosis?
Yeah, we can't say it enough. We were talking about it earlier, but limit your alcohol consumption and do not smoke cigarettes because those are both going to increase your risk of osteoporosis. And the other thing is if you do have a fracture and you're over 50, make sure you talk to your doctor about getting screened right away because your fracture could be due to osteoporosis and you'd want to know about it sooner than later.
Great information as always. Thank you, Dr. B. Dr. Brent Wallis, Chief Medical Officer of People's Health. It was good to hear that boxer bark, too. I'll tell you that. You can find out more about People's Health by going to the People's Health Medicare Center in Metairie. That's at 3017 Vets next to Party City. Appointments are recommended, but you can walk in. They'll be glad to take care of you. You can always go to peopleshealth.com or just call People's Health at 1-800-978-9765. When we come back, we'll talk to Dane Cialino, professor of law at Loyola, get the latest on former President Trump's legal travails. Right now, time for WWL First News.